Patients see osteoporosis on their report and think their bones are finished. They think they are stuck with the weak hollow bones for the rest of their lives. The first thing they ask me is, doctor, can I ever get my strength back, or am I just going to get weaker every year? In India, we treat bone loss like grey hair, something you just have to accept, but that is wrong. Hi, I'm Dr. Jayesh Bhanushali, and as a spine surgeon, I see people thicken their bones and move out of danger zone every single year. You can actually make your bones stronger again. Here is how. Inside your body, your bone is constantly being recycled. One process removes old bone, another process creates new bone. This keeps your skeleton strong and solid. In osteoporosis, this balance is broken. Your body is removing bone faster than it can replace it. When the bone becomes too thin, it cannot support the weight of your body. This is when fracture occurs. Reversing osteoporosis means changing this internal balance so your body starts building more bone than it loses. So how do we reverse the clock? It takes three things. Number one, the medication. We use specific medicines, often just once a year injection. These stop the bone loss immediately. They force your body to start building new layers of bone. This moves your bone from a danger zone back to a safe zone. Number two, calcium and vitamin D3 supplements. You cannot repair a pillar without raw materials. Calcium is the cement, vitamin D is the worker who carries the cement to your bones. If you have no vitamin D, the calcium is useless. It just sits there and never reaches your spine. Number three, walking and movement. If you sit all day, your bones think they aren't needed, so they stay weak. When you walk or climb stairs, the thumping of your feet sends a signal to your brain. It tells your repair team, we need more strength here. The vibration is what actually triggers the bone to get thicker. So can you reverse it? You can definitely reverse the risk. You can make your bones thicker so that even if you trip or fall, you don't end up in a hospital bed. Don't wait for the wall to collapse. Start the renovation today. That's all for today. I'm Jayesh Bhanushali, your spine surgeon, signing off, and I'll see you in the next one.